Dr. Luke Mai and Kimberly Van Keuren. They're both from Water's Edge Dermatology. But Dr. Mai, you are not a dermatologist.
Correct.
Tell us what you are.
I'm the furthest thing from a dermatologist. I'm actually an interventional radiologist, and I strictly specialize in venous disease.
And I found you because I have a doctor in Tampa, Dr. Christopher Pittman, that did my leg veins. And I was trying to find someone over here to do women that were asking me that couldn't travel to Tampa, because it's several procedures. And I looked all over the web for an interventional radiologist, and I found you. I was like, there's one here. So if you want to explain why that's better for leg veins.
I always say, you should go to the best doctor, the doctor that you like, but you should also go to somebody who specializes in what is that you need. I see a significant amount of patients who come to see me and have been all over different areas and have had some things done and are not happy with the results.
So many women tell me that they had their leg veins completely done and they come back. They say it doesn't work.
Exactly. And so I get a lot of those patients and, something was done and they're not happy. They're coming to see me, and I get actually a lot of referrals from physicians, and some of these patients end up finding me, and we kind of correct some of the problems to fix what the situation is. My number one advice to anybody listening is go to somebody who specializes in veins and only does veins. This is all that I do.
Don't go to a cardiologist, and every doctor is doing leg veins.
Exactly.
And
if he's treating your heart plus your kidneys and something
and your
else,
leg veins.
yeah, and then maybe you might want to rethink who you're going to. So, I think there's a lot of good people out there, and I think if they're specialized only in that, it's probably your best bet. Now, an interventional radiologist, interestingly enough, we are trained as radiologists, but we have special training in using small instruments to get in and out of the body to do certain procedures. And that, I believe, that tactile skill that we offer is probably some of the best that you can get, especially for treating small veins or venous problems.
I believe that because I know that a lot of my girlfriends have gone to other doctors around here, and like I said, the veins. I mean, they believe they can't be fixed.
Yeah.
Because it wasn't done properly. Yeah. And what are the other doctors doing wrong, or what are they not doing that's
I think my idea is treat the completion and treat the entire problem. I think certain people will do certain things that either are well reimbursed by insurance or because they're easy, and I think you really have to individualize to the patient. Diagnose them well, figure out what it is that's wrong, and then treat the problem, and don't let that patient leave till the patient is happy
completely
with the
done.
results. Exactly.
Okay.
Because the patient leaves, they're not going to be happy with you, and their friends are not going to be happy with you. But they are, then your business grows.
Because it's a lengthy process. I know it took me several visits to do my leg veins.
Exactly. And you traveled pretty far, actually, all the way to Tampa.
Yeah.
We have locations. I work out of 7 locations for Water's Edge.
That's why I was thrilled to find you, because you do have. I know you have a location right here in
Lighthouse Point.
Lighthouse Point. So all the people in East Boca can go there. And then I've also been to your office in Delray. And you work out of
all of them.
All of them. Okay. What's the furthest north one?
The furthest north is Ocala.
Okay. And what is your title with Water's Edge?
I'm the Director of Cosmetic Services for our practice.
Okay. And what, besides leg veins, what else do you do there?
Well, we just introduced plastic surgery to our practice.
Oh,
we
have
have
a plastic surgeon
that joined us.
Oh, my goodness.
In our Stewart location.
Wow.
We do injectables in all of our offices. Laser treatments.
I know you started the laser on me, and we're going to continue that. You're going to get rid of all of my brown spots.
We actually have a little something for everyone from head to toe now.
So anything you need done. Anything from the leg veins to plastic surgery now. And what you're doing on me involves a laser, and I had one treatment, I think, and it was very impressive because I've had laser before, but this is a newer laser.
Well, the technology isn't newer, but what's different about the laser we have is traditionally you couldn't treat all skin types before. You had to be more fair. We had to treat to lighten the skin before we treated. The technology that we have now, the laser is very sophisticated, so we can actually treat all skin types.
Okay, and I noticed a difference. I had a similar procedure done with another laser a couple of years ago, and they treated me, and then it blistered up. And then I looked like hideous for a while, and then all the brown spots came off. But with the laser used on me, it kind of got I know you did the sides here. It got like coffee grounds. Mm-hmm. It turned into and then they just kind of
that's normal.
Disappeared.
Blistering is not normal.
Yeah. See. So yeah.
So it's a little too aggressive for you.
Okay, that was the difference.
Yeah, the intensity needed to be turned down a little bit.
Mm-hmm.
But no, you can definitely have a safe, effective treatment without having those side effects. You definitely want to make sure you're going somewhere where You have laser trained technicians that are really good at doing it. They do a lot
That's
of
important.
it, not just do it every now and then. And this is all they do, a lot of laser services in our practice.
Now, I would imagine that ties in with the leg veins because
It does.
once you get rid of the veins, like I got rid of my veins, but I still have all these spots on my legs, which you're going to help me with.
Well, I'll tell you, I used to notice all the spots, but since working with Dr. Mai, I look at all the women's legs now. I can't go anywhere where someone has shorts on and not notice
Not notice.
the veins up and down their legs. And before that, I didn't pay attention to them, but it's crazy because I think, oh my gosh, and the ones that have the spider or he calls them tarantula veins, I look at
The
and
big,
go,
Big spider
the
veins.
big spider veins, or I don't know if you've ever seen the people that have the really dark purple
I had them
calves.
all. I had like,
No, the dark, you do not. The dark purple, really red, dark calves.
Yeah.
I look at it now and I think, oh my gosh, there's something really, really bad going on that they need to come in and see someone for, and they're not even aware of.
so that would be a venous disease?
Yeah, you know what? There's a lot
is.
of patients who below the knee and just above the ankle have redness of their skin, and it's actually just inflammation from abnormal venous disease, and they don't recognize that. And a lot of physicians or primary care doesn't recognize that either. These patients actually end up in the ER and get treated for infections. They're given antibiotics, which is completely, the incorrect direction to go.
So how do you treat them?
You know what? We put them in compression socks right away, and we treat them for the venous disease, and they do significantly better. The problem resolves and doesn't come back.
So do you laser?
So what
Those-
happens is when the redness comes, when the redness is relieved, it actually turns into a brown pigmentation, and that's actually some of the iron that's being
And that
deposited.
stays in the skin?
Yeah, it used to be thought that, well, we still think in generality that it's forever. It's pigmentation from iron. It's almost like a permanent tattoo. But we've been working actually with one of our laser girls and trying
get rid
different
of
lasers out.
We're actually getting some lightning from it. We're testing with it.
Oh, wow.
And we've had some good results. We're taking specific subset of patients and doing a clinical trial, and we have had good results. So I'm hoping that's something we're going to be able to offer pretty soon. Nobody really is offering it at this point anywhere.
Wow.
Yeah.
That's interesting. Well, I know, before I had my leg veins fixed, I didn't want to show my legs because of the veins. But then I got rid of the veins, and then I got the brown spot. So I'm a work in
There's
progress.
always something.
But now, when you started me, you gave me some topical things to use first. Do you want to explain what those are?
Sure, I can.
Okay.
Well, I like to do that with anybody. I think that if we can pre-treat your skin, it lessens the risk for blistering. So
Okay.
we want to, if someone comes in and they have a little bit more pigment than normal, if you've been out in the sun, we would never have you come in if you've had any sun within the, I'd say 21 days.
Yeah.
We wouldn't treat you because there's a risk of blistering. So what I like to do is if we consult with you beforehand, we take a look at you, and what we recommend is to regulate your pigment production. We want to stop your melanin from producing all the brown spots first. We want to arrest it.
So that was you did that with one of those topical treatments you gave me?
So it actually helps to slow down the production of melanin, but it also lightens what you have and it exfoliates off the top layers.
All right. Which product was that? I remember you gave me something to use in the shower,
You've
and then you gave me
got
some
an
cream.
exfoliating polish.
Okay.
To help to use in the shower. So that has a light retinol to it. It helps to break up the pigment on the skin.
Okay. And this is all
exfoliate
done
everything
before
off.
you treated me with a laser.
Well, ideally, some people don't want to have the time to do all of that before they have something they're going to. So everyone's a little different. But in the perfect world, I would love you to come in and start treating beforehand to kind of get everything started, get the skin brighter. We can use intensity and more intense settings. If your skin's regulated, lightened, we can actually go a little bit deeper and treat you better.
Okay. And I know you gave me some kind of a topical cream.
We
it
have
called?
a
Zoe? Am I saying that?
yes. There's two. There's our WeDerm. It's a glycolic lotion, which helps to brighten the skin, exfoliate the skin, to keep the skin. It helps with elasticity. So aside from the lightening, there's also some cosmetic benefits that you get from it. The other one is our Zeo Bright Alive.
I love that one.
Okay, so that's the one that's actually
Yeah.
regulating your pigment and brightening everything up.
That was
So,
amazing.
Yeah, I absolutely love those products, but I wouldn't say those are my go-to products, but every's different, so
Right.
we definitely
Depends on the
customize
person.
it to
Yeah.
everyone.
Okay. So the process is you started me on that, then you did laser. Now what's next? I guess I need a lot more laser.
Well, it's after the summer, so you're going to need to
It
come
was
in.
so hard in the summer.
You
I'm
look
so-
wonderful.
This is a
but
better time of year to
This
do
is
this.
after the summer, so we probably need to get you in and take
Yeah.
a look and probably get you started
And
again
start the
with
laser
the
again.
treatment.
And then how often do you do the treatments if you're gonna?
Well, it depends. It depends on the level of.
So I'm trying to remember how long it took for it all to.
You had a lot. So we
Yeah.
did a lot of areas.
Yeah.
So you probably want to do it once a month. It depends. Once a month, every 4 to
Mm-hmm.
6 weeks, but you don't have to do it indefinitely. If we have your pigment regulated and you're using products to kind of keep, and staying out of the sun is the most important.
So
wearing
can you
sunscreen.
bring someone's skin back to the way it was in their 20s or early 30s? Is that possible? Or- okay,
I
I'm
would
kind of
love-
hoping here.
I would love to say that we could, but by the time we're in our 40s, 50s, there's a loss of elasticity. Especially if there's a lot of sun damage there. So
Right.
what we want to do is we want to use products that stimulate your own collagen, kind of bring back some of the elasticity. So we're looking at, and sunscreen. Sunscreen is the best preventative.
Oh, yeah.
So I would say using preventative products and then using products that stimulate your own collagen.
And by stimulating your own collagen, you're rebuilding, you're strengthening the
You're
skin?
strengthening your skin. Retinol, I'm a huge fan of retinol. I think everyone should be on retinol starting from their teens when they're in acne, when they
Really?
have acne.
Do you use it on your whole body or just your
You
face?
can use retinol on your whole body. I have our patients mix it. I have my own little thing where they mix it with like a good lotion. If you have stronger, thicker skin, I recommend our We Derm glycolic lotion. It's really, really good.
And can you use this stuff indefinitely? Is there any danger to?
You don't want to use it indefinitely. I like pulse therapy, so you want to use it for
Okay.
maybe a month and then go off of it for a little while and then go back on it. You don't want it.
And that'll give you the best quality skin if you do it
It
that way?
does. Back in the day, they used to say that it would thin your skin out too much. So some people that have thinner skin, retinol, it actually thickens the skin. But for some
Okay.
people that have really thin skin, it could be too much for them. So they're maybe a little more sensitive.
Okay.
So for me, I like to say stay safe and use it maybe just a few weeks on and then go off for a
Then
few
go
weeks.
off.
But definitely making sure you're using something that's bringing out new skin. You want to make sure that you're not going backwards by not putting your sunscreen on daily.
Okay. Well, we're going to chart my progress here and see. I have brown spots. If you could get rid of these,
I can get rid of those.
and then I could see where you could work in tandem with this guy because
This is
you gotta
fantastic, right? I have a
We
question
do.
about something and bring Kimberly in.
Right.
You know, on the other hand, if I have a question about something about dermatology, I have a dermatologist right there.
It's nice that
And
you're
it's
all
really,
together.
I mean, it all kind of works together. And
Right.
amazingly, I've sent patients from one room to another, and we
We
biopsy
do.
on the same day. It's just
Mm-hmm.
amazing.
No, we do. We have patients that come in, and if you see something that's bothering
Because you've got
them,
dermatologists in there too that
Oh,
will
We
do.
do.
Okay, so you have a plastic surgeon, dermatologist, interventional radiologist.
Radiation oncology.
Radiation oncologist. That's the
Oh,
other one.
really?
We
Yeah.
do.
Wow.
We
For
actually
skin cancer? Is that?
for skin cancer.
Oh,
Mhm.
okay.
We traditionally people would go to a hospital to be treated with the electron beam therapy is what we call it with radiation. But we're actually the first practice to have this type of technology in our office, and we have 5 locations that we offer it.
You have it in 5. Oh, wow.
We do. So it's a
Okay.
huge compliment to our patients. They're not having to go to a hospital and get the treatments. They're actually
Right.
getting it in our office. Where
And how
our
long is
providers,
each treatment?
They're actually very quick. It's specific to the area that they're being treated.
So if someone had a skin cancer on their face, they would come in and
Well, it's a special type of skin cancer. So they would come in and meet with one of our radiation oncologists, see if they're a candidate for it. And then they would, they actually have to create a mold for the area that has to be treated. And I've watched them do it.
Really?
It's actually really neat
why do they create them all?
because it's specific to the size and type of skin cancer that you have.
Interesting.
So everybody's mold, everybody has their own mold that
So
they
is this
treat.
different from Mohs surgery?
It is.
that- okay. Is
This
a
is
new-
if you're not a candidate for Mohs or if you don't want to have surgery. Some people would just not want to have that and
Sure.
just go for this, which is a lot less aggressive.
Mm-hmm.
And also people have cancer in all different places that inside your ear or
Right.
places, where you could see it where you may not want to have a scar. So this gives us lots of options.
So that you don't get a scar with this?
No.
Oh,
No, it's
interesting.
amazing.
Wow.
Absolutely amazing what I've seen.
Huh. Okay. And tell me where all your locations are because I know you have a lot of them.
Oh boy.
If you can
You're gonna
remember.
test me here. So
I've
we
been to 3 of them, I
have-
think.
Okay, so we have locations. Our furthest north, we have 2 locations in Ocala. We have 3
Ocala, I
in
didn't know
Orlando. We have, my goodness, we have.
You're all up and
I
down
think
this
they-
coast.
We are all
Yeah.
up and down on this
And
coast.
the
Port
easiest
St.
place
Lucie,
is
St.
just
Lucie,
say, go
West
to our
Stewart.
website and look at all 29.
Thank you.
Okay, so what is your
WeDerm.com.
website?
WeDerm.com.
WeDerm.com.
We have all of our locations there, but we have them. It's very convenient. Literally down south here, we have Lighthouse Point, Delray, Wellington.
Yeah, I know that.
All in the Palm Beaches. We have them in Port Charlotte, Arcadia, Okeechobee,
Okeechobee.
Clewiston,
Oh my goodness.
hmm
And then, oh, interesting. It's all one
Lake
group.
Wales.
Okay. You want to tell us anything else about your vein work? What is the typical complaint? I know it's spider veins, but that's not always
You
the.
know what? Women usually in Florida come in and say, "I want to wear a skirt again," or "I want to wear a bikini." I think it's probably one of the bigger ones,
Right.
especially from a cosmetic standpoint. I can totally understand that. But I'm seeing a lot more medical patients. I think as the group is expanding.
That have what? The venous disease?
Have venous disease. People are presenting with skin discolorations, like we talked about the
Yeah.
laser treatment. People with venous ulcers. Some patients are presenting with symptoms, and that's very
What are
interesting
symptoms?
to me. Patients come in and say, you know, at the end of the day, my legs are heavy or uncomfortable. My legs are always in pain. I started asking one question to almost every patient, and I said, do you have cramping at night? And I'm very surprised how many patients says, yeah, I have cramping at night, wakes me up in the middle of the night. I have to walk around and I go back
That's
to bed.
from leg veins?
It's from lag veins.
Wow.
Interestingly enough, I put them in compression socks, something nice and sporty they can wear during the day, and have them come back for an ultrasound, or a week later come back and see me. And I would say majority of those patients come back and say, cramps are gone. What did you do? Tell me. This is amazing.
So that's your test to see if they need
Exactly.
a procedure.
Exactly.
So then what procedure would you do in that case?
It depends what the ultrasound shows, but you can do some vein ablations. We can do some sclerotherapy, just tailored to the specific patient, you know. But as I said, as I'm expanding the practice, we're seeing a lot of medical patients. I'm actually seeing a lot of patients with blood clots, and we're getting more work done with that. We're doing a lot of more imaging in the pelvis to see what the veins are doing in there as well. The interesting thing about blood clots is patients with blood clots really should have them removed. And that's not something we're doing
Sure,
as a
I would
medical
think so.
community. Yeah, we're not doing that. We're putting patients on blood thinners, and then those patients basically go home, and nothing's really done about it. So we're pushing as much as possible to say, look, if you had a blood clot in the hospital and you were left the hospital, come and see us. Let's see if we can remove that blood clot. Because what we're noticing
Is there a danger to leaving it in there? I mean,
You know-
it sounds dangerous,
well,
but
the
I guess
patients
it's
are
not.
put on blood thinners so the blood clot doesn't get larger, propagate to your chest, and cause a pulmonary embolism, which could be really dangerous.
Mm-hmm.
But what the problem is when you block the road of blood traveling, it causes venous hypertension, high blood pressure on the vein side, and that actually causes symptoms not today or tomorrow, but 3, 5, 10 years down the line. Patients
Mm-hmm.
present with just horrible symptoms from venous hypertension because of those blood clots. And so you have to really track back, say, okay, 10 years, what happened 10 years ago? Oh, I had a blood clot. Oh, well, because that blood clot is what's causing all of your problems because it was never removed.
Wow.
So we're now looking a lot of more medically from the standpoint of veins. You know, back in the day, 10 years ago, 20 years ago, we'd say it's all cosmetic. Let's just treat it from a cosmetic standpoint. Where today we're saying it's not cosmetic, it's medical. You have symptoms, you have a problem,
And you treat
this
that.
is why we treat it, and this is why the insurance pays for it. And that's
Oh,
again
that's
a
an
misconception.
interesting point because I didn't know that until I had my leg veins done. But if you're diagnosed with venous disease, which a lot of people have
Mm-hmm.
when they have the symptoms,
Exactly.
that is covered by insurance. So it's not
It is.
strictly a cosmetic.
Exactly. There's not one insurance company I know that does not have coverage unless there's some kind of exclusion. And that's one of the things that patients say. They're very surprised when I tell them this is going to be covered by your insurance.
Mm-hmm.
You know?
Right. Well, it should be.
Yeah.
So, are there doctors out there that are just treating the surface veins and not the underlying problem? And that's why my friends are telling me it didn't work?
I think so. What's actually funny is I got an email maybe like 10 minutes before I walked in the room here, and it was an advertisement from a physician that offers sclerotherapy for spider veins. Which
Wow.
I think
Only
to
the
myself,
sclerotherapy and not.
yeah, I think to myself, well, that's great, but what about everything else? And there's actually one center that refers to me. I went and gave a presentation at the center, and I said, look, I don't mind if you treat it from a cosmetic standpoint, but my real question is, what do you do with everybody else? And I said, well, we really don't do anything. And I said, well, do you feel like those patients should deserve some kind of care? And I said, yeah, but we would love to know where to send them. So we actually have a nice relationship now. That
Yeah.
all the patients that they need to be treated from a more aggressive standpoint, they come to me and we treat them. And then those patients go back to them and get their sclerotherapy or whatever it is that they want to do.
So, if someone has a lot of spider veins, is that from an underlying venous disease, or is it just?
It can be.
And
Right,
you can tell
there's-
that by doing an ultrasound.
Yes. From
Okay.
seeing the patient and doing ultrasound, I see exactly what's going on. And it's the symptoms and what's presenting on the skin that we look at it together.
Okay, so sometimes you do need to treat them more fully, and other times you just need
Exactly.
to do sclerotherapy
Sometimes
on
when
the
we get
surface.
older, we get spider veins that appear just part of normal aging. And those just can be taken care of by
you can just get rid of those.
sclerotherapy. Yeah.
Yeah.
We have different modalities. Lasers is one of them. You know, we have sclerotherapy, which are obviously the injections. We have another machine called the Van Gogh, which is a kind of
Oh
funny
yeah,
name.
you showed me that.
Yeah.
Yeah.
we saw
So what does that one do?
It's a very tiny little needle with a tip, and the tip just basically touches your skin and delivers a sound wave called radio frequency.
Oh, you're kidding.
And that radio frequency shuts that vein down. I have to tell you, it's one of the most favorite toys that I have. And because you just touch
Wow.
that vein and the vein disappears. And I
So
treat,
what is it doing? Is it heat? It's sealing
it's
it
not.
off? Or-
All it is it's a little bit of heat and a sound wave. So it's radio frequency. Basically delivers that sound wave, produces a little bit of heat, and basically solders it.
Solders it.
Yeah. And we use it
Wow.
on legs. I use it on face. I use it on 3 patients on the face today.
Oh,
on
you
the
mean if someone
nose.
has those little
Yeah, those
red...
little red veins. Yep. We treat them everywhere.
Wow.
Their entire body with them. Yeah.
Wow.
hmm
That's interesting.
Yeah. Patients are just amazed when they walk out. They have a little bit of redness.
And then,
Tell them to use sunscreen. They come back a week later and everything's cleared up.
oh, that is amazing.
Yeah.
And that's just from the vein go. Is something like that covered by insurance?
That is unfortunately not covered by
No.
insurance.
Cosmetic, but that's probably worth it.
Yeah, it is.
It's right on your face. Yeah. Okay, so do you work in one particular office or do you move? I know you're always all over the place.
Yeah.
Kimberly will be wherever
So-
she is.
So I work in most of the southern offices down here.
So that would be Boca and Pompano and
Boca, Lighthouse Point, Wellington, West Palm Beach, Delray, Jupiter, and Okeechobee.
wow.
Okeechobee.
Uh-huh.
You go to one every day or how do you?
Sometimes 1 a day, sometimes 2 a day. Kind of depends what the
Oh
need
my
is.
goodness. Okay.
You know, I open up extra days when you need them. I'm actually Palm Beach Gardens was actually on our meeting today, and Palm Beach Gardens I'll be starting there soon.
Oh boy.
And my biggest thing is to try to expand even further. And I think the care is needed, the patient's needed, and I think we offer a great service. And so we're actually going to expand the vein center for Water's Edge to hopefully almost all, if not most, locations. So Water's Edge has 29. The
Wow.
vein center is the largest vein center in Florida. We have 10 locations that we service, but we're going to try to move into at least another 10 more within the next, maybe hopefully, year or 2.
Wow, that's fantastic.
Mhm.
I know I've been sending everybody to you that's
I was just going to
appreciate
say
it.
that
that's
so
local.
Much, so much. of it
I
is
try
we-
to send people to my friend in Tampa because he's great, but you know it's a repeat.
Yeah.
I go up there a lot anyway, so it's good to have someone here because
It is,
know.
and we built up the practice. Dr. Mai so fast. I mean, we were shocked, and it was all from referrals.
Yeah,
We weren't
that's
doing
the way
crazy
South
advertising.
Florida
we weren't doing
works.
anything.
That's the way it works around.
It was
Word
all
of mouth.
referrals.
Mm-hmm.
You know, I always say if you take care of that patient is going to take
They
care
talk.
of you.
Absolutely.
And that's the most
Absolutely.
important part.
Yeah, that really is. And since you've got locations all over the place,
Mhm.
it's easy. I know, like I saw you in Delray, but then my friends went and saw you in Lighthouse Point. So it's like, which is right here. So that's very good. Anything else you want to tell us about your practice before we go here?
Like I work at Water's Edge, but I have to tell you, when I first started, I told this Kimberly when I started, I was very impressed, and I was impressed by the quality of people and the physicians I work along with. You know?
Mm-hmm.
And I think that's the biggest difference is that I'm able to go to the dermatologist, go to some other physician, radiation oncologist, and we meet together and talk about different
It's
cases.
interesting that you have plastic surgeon, radiation oncologist, dermatologist, interventional radiologist. Anything else?
And we have a full aesthetic team. We have
So you
paramedical
Botox fillers,
estheticians.
all that stuff.
All of that, and also peels, microneedling. So our paramedical estheticians are very, very advanced in what they do. So aside from that, not your typical facial, but real acne treatments, anti-aging treatments as well.
Oh, so you've got everything.
We do.
Okay, well.
One big happy family.
Yeah,
right?
I got Okay, so we're going to chart my progress. I'm going to come see you with
Yes.
that laser, and we're going to get rid of all these brown spots.
We will.
Okay, all right. I look forward to that.
Awesome.
Thank you
Appreciate
very
having
much.
us here.
Oh,
Thank you.
anytime. I'll have you back, and we'll have you back to show my progress too. So, because like I said, once I got rid of the leg veins, then I saw all the spots. Okay, thank you very
Thank
much.
you so much.
And
it's a pleasure.
it's your website again is
WeDerm.com.
WeDerm.com. Okay, everybody.
WeDerm.com.
WeDerm.com. Go look at their website. They have like locations all over the place. And if you have anything from spider veins to what's that orangey brown thing called? Where
Skin
you
pigmentation.
skin pigmentations, or you just want Botox and fillers, my favorite. You do all that there. Chemical peels, things like that.
Chemical peels.
Laser. I know there's a laser. There's one doctor with you that's doing some kind of a laser treatment to the
We do
face.
an ablative and a non-ablative laser treatment.
Okay. So just about
They're
anything.
both absolutely amazing.
Okay. All right.
If you need any advice, come and see us. We're more than happy to talk.
Okay, thank you. Certainly will. Thanks a lot. Bye-bye. You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not